Welcome to the Stretch to Go podcast. My name is Ian Ray. I'm your host today, and today I have Erica. She's based out of Sydney, Australia. She's an online coach, fascia stretch therapist, level 3 certified, and also a future sports psychologist. Erica, welcome to the Stretch to Go podcast.
Thank you for having me, and thank you for accommodating for the time zone difference.
Yes, no problem. I just interviewed someone in New Zealand, so this is perfect.
Oh, amazing. Yeah.
All right, Erica, people want to know who you are, and how you got to this point of being a fascia stretch therapist. So kind of give us an overview, your upbringing, your backstory into, personal training, because you're also a strength and conditioning coach, correct?
Yeah, and
Okay.
that's how I started actually. So I've been a strength coach for probably close to 9 years now. Fascia stretch therapist probably for close to 5 years because I did my original level 1 in 2019, right before the COVID shutdowns stopped me from doing level 2 for about 2 years. So that's actually how I started. And for a long time during my strength training career, I really wanted to get into some sort of body work. Because as I was teaching people how to move, getting them to be the strongest, best versions of themselves, I realized there was a limitation to my skill sets as a PT in terms of how to help them. I'd get people coming in, and if they had some sort of acute or frequently chronic issues, sometimes having a manual treatment at the time can be really beneficial in reducing those pain signals, but also restoring range of movement, in which case they're able to access certain positions to be able to get the most out of their strength training. And I thought about this pathway for a long time, kind of thought about pursuing massage, but then the person I was working for at the time, who was basically like a really big mentor, and I worked for him for probably about 6 years, he recommended against massage. Mainly because in Australia, massage is still very common. There's also a lot of great therapists out there already. And he thought the market was already quite saturated with that sort of skill set. So he was like, if you're going to do something in the realm of body work, you should probably wait and see. And if you can, contribute in some other way. A couple of years down the track, I had an ex-colleague who actually went and did FST level 1. And then I researched a bit more into the technique, and it was really in alignment with sort of my therapist values. And this was also in line with the time that I started commencing my postgraduate studies to be able to become a psychologist. So in Australia, I'm not sure how it works in the American system, but in Australia, we have what's called a bachelor, and then to become a registered psychologist, you have to do another 2-3 years worth of study. And the final degree, which is like a master's degree, you have to actually qualify for it by going through a 4th year, like honors or graduate diploma degree. So it was a very long process. And when I started out on this pathway, I was like, I want to do something which is in alignment with the values of at first do no harm. So even if you can't directly help the person, you don't want them to walk away having harmed them even further. Yeah. Yeah. And when I researched up into FST, I thought this is actually such a beautiful modality. It's very gentle. It's not as invasive. And it placed a lot of value on the listening and the collaboration between the therapist and the client. And it had all these things that I was really looking for. And as it turns out, when I went to the course, that's also how they teach it too.
Yeah. Did you have any initial thoughts about enrolling in the Stretch to Win course, or like any hesitancy at all?
I want to say yes, but no. I was pretty determined. When I have my head fixated on something, I will do anything I can to make it work. So I was like, no, booking the course. At the time, my employer paid for it as well. So booked it, just not many delays. Yeah, I was like, no, I think this is where I need to be going, and it just felt right. And I was like, you know what? At the end of the day, even if it doesn't work out, that's okay because I've got a new skill set that I'll make work.
I guess so. With this ex-colleague of yours, this was in 2019. You heard about it, right?
Yeah.
Cool. As far as like those people probably who are listening, who are on the fence about like, what is this Stretch to Win course? Like, what would you tell them for people who are on the fence about enrolling, whether or not to go? Especially because it's a time commitment, it's a financial commitment, but like,
Yeah.
you know.
Yeah. From Australia, I remember every time I did, so when I went and did level 2 and did level 3, all of it were huge financial commitments. Even if as a small business owner, there's a certain amount that you can, claim on tax and things like that to help you, it's still not the whole amount. So it genuinely is an investment. And I think when you have a really big financial commitment like that, especially if you're unsure if you can afford it, financially it will pay off in the future. I'm pretty sure I made back the entire course within like the first two months or so of coming back. And that's in Australian dollars. And even at the time, Australian dollars are still doing pretty poorly compared to the American one. But I suppose arguably I also did have a client base, but it is absolutely worth it, like in terms of the course itself. So financially it makes sense. I think also from a perspective that you actually meet a lot of really good therapists. It changes your life both as a therapist and as a person. Each level does the same as well, because you kind of meet different people. Sometimes you actually come together and you realize that you've done all 3 levels together, which is even better. I've got some lifelong friends over in Canada as a result of it. And the other thing is, unlike lots of courses where you do the course and then you're sort of, you have to go off and do your own thing, I do feel like with FST, there's support all the time. So we've got like the different forums. Because of my connection to different therapists as well, I've always had someone to bounce ideas off if I'm unsure of something, or if I'm wanting a little bit more assistance with a clinical presentation, or if a session has just been particularly hard. Like there's been sessions where people have come in and you're just like, actually, this one's just stumped me. Has anyone ever had this before? So I think if the reservations that you have are financial, I definitely think you need to find a way to make it work. I do think there will be a way to make it work for most people. And if it feels right for you, I think definitely do it. Yeah, I think FSC has changed the life of many people.
No, that's 100%. I think my level 1, and I'm going to level 2 next month, and this at the end of the month.
Nice.
But like level 1 is, like I said, I agree. Like just the type of people who are there, they just have a certain mindset. They have a certain type of personality that kind of like attracts it, And it's, I don't know. I think I've probably connected deeper level rather than like in college. Like when I went to university, like I don't talk to them, but no, I still talk to my colleagues that I went to. So totally true.
It's absolutely, and I think there's something about the course where when you go into that space, I don't want to say forces you, but basically it kind of allows you to pull your walls up, the walls that we normally have, on a daily basis, that we probably need in other parts of society. But in these courses, it's not like that. And there's huge diversity in terms of like culture, ethnicity, like different countries as well. And yet we all come together with this common goal of actually we want to better the world and we want to become better therapists. And I think having that is really powerful, because even if 2 people are extremely different, having that common goal allows them to work together and also share stories and also be vulnerable. And change and healing only happens when people are vulnerable. I remember in level 3 was probably the course that really changed my life, because even prior to that, I was very much like hyper independent. I was like, no, I don't need help from anyone else. I'm gonna be helping everyone else, but I don't need that. And I basically built a life where I could sustain myself independently, even if that was to my detriment. And I'm sure there's a lot of therapists and a lot of perfectionists out there who could relate to this, because I know for one that probably some of the best therapists, that's actually one of the hurdles that they have, is they can't ask for help themselves. And then I went into level 3 and I found myself being amongst some of the best therapists I've ever worked with. And I was like, wow, even they cannot stretch themselves. They need me and I need them to work on each other and for us to be able to release things that we can't do ourselves. And I was like, at the end of the day, we're only human, and actually it's okay to need one another and it's okay to rely on one another as well. But for that to happen, you need to open up and you need to be vulnerable and you need to have a space in which to do that. And I think definitely fascial stretch therapy and the Stretch to It Institute provides that very well.
Yeah. That's true, because I know getting on the table and stretching different people each time. I mean, you just hear the story, like you have to open up. Like it's just normal. It's just that it happenstance that you're bound to have some kind of a connection at the end of the week. Quickly want to find out, who are your demographic and population that you're typically working with FSD?
Yeah. So I guess I've got two main ones. So first would be like the athletes. So I get people coming in who are like powerlifters, weightlifters, quite a few combat sport athletes actually, like Muay Thai and kickboxing and things like that. And then my other main demographic would be people who've had really chronic issues that have not resolved for multiple years at a time. And they usually come in reporting that they've tried everything. They've tried scans, they've tried physio, they've tried chiro, they've tried massage, and nothing has actually helped. So those would be the two main demographics that I work with. And then, aside from that, it would be like the usual desk workers who actually train. So what I would call like the I don't want to say amateur athlete, but like the hobby athletes who really love their sport and love their training and understand the value of it on their health, but primarily because of the work that they do, that takes a toll on their bodies.
Yeah. Do you have some success stories or wins that you have about clients from the time that they come in till, maybe weeks and months of how you've seen them, how FST has helped them?
Yeah. Let's see. So I've definitely had some people come in where they've had like a shoulder or a hip issue that they've just had pain in, or niggling, what they say, and like a constant monitoring, oh, it's going to be painful, it's not going to feel right, for probably over 10 years. I've had people come in and after one treatment that's resolved. And it's like a sense of relief that they haven't received ever with any other treatments or any other modalities. And right now I feel like there's a bit of a, like if you look on social media and what the sort of trend is, there's a lot of downplaying the role of manual therapy. And I'm going to also say this, all my treatments involve some sort of homework or some sort of strength training if the person is not already engaging in strength training with a coach. I firmly believe that resistance training and strength training and that sort of loading of the movement and loading of the ranges of movement that we free up in treatment is so important for long-term maintenance and being able to actually move away from pain long-term. However, I think there is really amazing value in getting someone in who's had pain for about 10 years. When pain has persisted for over, I believe it's like a couple of months, that becomes chronic. It actually results in adaptations in the spine and the brain. And that is not as scary as it sounds. It just means that the entire nervous system becomes very sensitized to producing pain signals to things that previously it might not have. And this is based on the research that they've done on like chronic pain patients. People with fibromyalgia or people with like phantom pain, that's what they found, is that in an effort to protect the person and protect the system, the brain and the spinal cord just becomes really sensitive. And by that point, you could throw all these kinds of movements at them, but their body is like, no, I don't want to move that way because it's going to cause pain. So when you use manual therapy to be able to downplay those pain signals, get the nervous system to calm down and restore the range manually, they will get so much more out of the strength training or the homework that you give them. And I think that really needs to be acknowledged in this sphere, because right now everyone's shitting on manual therapy and I'm sitting here being like, kind of get it, but also I'm not like, I know so many people who've benefited from coming into my therapies, and I know there's a lot of my, fellow fascial stretch practitioners who are doing amazing work. And I'm like, you can't sit there and tell me that manual therapy doesn't work, because it does. There's a time and a place and a context for it. There is one success story that really comes to mind. I had a guy, he lives up in like the Blue Mountains in Sydney. It's these amazing sort of Great Divided Range that we have. And he came down for a treatment session. It takes about 2 hours to drive to where I was at the time. He couldn't lift his right arm, couldn't rotate his neck. About a couple of years ago, he had fallen off a big scaffold in Thailand. And he was like, ever since then, after all his surgeries, he was just immobile, couldn't move a lot of his limbs, always in pain. First treatment, I even have videos still, I remember. He was able to lift his arms to like full flexion, rotate his neck full flexion. He was just like, this was a range that he hadn't seen ever since the accident. So I look at things like that and I'm like, these aren't things that you can really capture in studies. You can't do let's say like a randomized control trial in very controlled settings, because sometimes the magic of the treatment happens because they come in, you listen to their story, listen to what happened to them, listen to how it impacted their life, because these are all things that they carry with them. These are also all things that impact the nervous system and movement and ranges of movement. So when we are commencing with the treatment, we are taking into account all those things and holding space for it. And then that's part of what I attribute to the success of FST as well. So, you know, this man, even it was unbelievable for me. And I was a level 1 back then. He was one of the first treatments I ever did as a level 1.
Wow.
Yeah.
That's some powerful stuff right there for level 1, being able to do that.
Yeah.
I think that kind of shows like how great this modality is. Like, I mean, I can't imagine myself doing level 3 or 4, you know, like how much further I could help clients. But even just level 1, I mean, they say it's the you master the technique, right? So
Yeah.
definitely,
Yeah.
I'm hoping I can continue to hone it. I want to kind of go back to what you're saying about manual therapy and whatnot, because or even like people who are overcompensating on injuries, right?
Mm.
I think injuries, like let's say like ankle, knee injuries, I think the stretching and the flexibility makes sense to me because like a rubber band, if you keep stretching the rubber band, it gets loose. But then if you're not pulling it taut, it's not gonna it's not gonna have any shape anymore. And I feel like the same. Like I totally agree with the strength training and the flexibility. It goes hand in hand. Like,
Mm.
and I always tell clients is like I can stretch you all you want, but you're not gonna get
Yeah.
that long term effect. And so I think that's why this modality is great as a complement to everything else. This is not going to be a
Yeah.
fix-all everything. If anything,
Yeah.
this is a great modality to have on the side with those things. So kudos to you.
Yeah. Yeah. I think it's really interesting because after I did level 1, I was so keen to do level 2 and level 3. I was like, yes, this is what's going to elevate me to the next level. And then I've also recognized that there's a lot with probably the best therapists I know in the FST course as well, but you keep coming back to level 1. There is a reason why it works and there's a reason why you do it first. And I think level 2 and level 3 equips you with a lot of problem solving. So if someone comes in and they're pretty keen to be done in like, let's say 3 sessions, realistically, I would say most people need between 4 to 6 to be able to achieve some sort of long-term change. But let's say they need 3, then I think level 3 stuff and level 2 stuff works really well because you go deeper into the joint, you assess, treat, reassess. And I think like I've definitely been using that a lot more recently because sometimes I think it's also really important to try and see how much change you can achieve in like the first 2 sessions rather than, you know, making it a little bit more restorative. But I think I'm sure you'll experience the same actually. Well, after you do level 2 and level 3, you'll have a couple of weeks where you do the really advanced stuff and then you kind of go, okay, well, I think go way back to level 1 and I think that's the stuff that sort of works for the really chronic stuff too. Yeah.
When you are meeting with new clients, how do you explain fascia to someone who doesn't know about it? Do you have some kind of analogy for them to understand?
Yeah, I tell them that there's no part of our body that doesn't have fascia, and the fascia is like the glue or a coat of connective tissue that holds our body together, and it helps our body move, absorb force, and generates force because it connects different muscle groups together, almost like a train track. So if that train track's really clean and it's able to work really well, then you're going to get a really good flow of movement throughout that entire sling of fascia. But if there's one area that has a bit of a dysfunction, so it's either crinkled or it's sort of out of place, then it can have an impact on the entire chain, so that some of the symptoms that this person is experiencing may not necessarily be because of the area that is in pain. The other analogy I use is just clothing in general. So I'll usually like sort of scrunch up a part of my clothing and be like, so see how if we pull one part of the structure, it impacts the entire thing. That's essentially what fascia is like. We want the whole thing to be very malleable, very flexible, and flexible in this case meaning it's very adapted to any sort of stimuli you throw at it. So if you need to jump, it could jump. If you need to change directions, it can do that. Whereas for a lot of people, if their fascia is rigid or if they've been sitting in a certain position for a long time, and or for some of my powerlifting clients, if they've only been training in the sagittal plane and only doing their competition movements, they're going to be super rigid and not very adapted to oncoming forces and different sorts of stimuli too. Yeah.
Yeah. That's such a two-dimensional type of thing with powerlifters. So I can only imagine trying to
Yeah.
get them to work different angles and planes.
Let's get you to rotate a little bit because you seem like you can't rotate at all.
So for yourself, in your business, your clientele, do you have some long-term goals for your business as far as FSC and online coaching? What are they?
I think I would So I started running, I guess, some seminars last year.
Hmm.
And I would like to keep doing more of those. I'm currently working on like a mobility module that people can access online because I've actually had people reach out to me from the US or Canada and asking me where I am, and I'm like, I'm in Sydney, but you can go to these other people because I know so many good therapists that you can go to them instead.
Yeah.
But if I could provide something which allows people to work with me regardless of the distance, I think that would be great.
Mm.
And in terms of the FST, I'd like to go and get certified in level 4. I'm waiting for my degree to finish next year, and actually finish my registration so that I've got a little bit more leeway in terms of time to be able to travel over there. Because again, it's going to be a huge commitment in terms of like the week and then the flights and then the course itself and the accommodation. And I'm telling you right now, the exchange rate's not good at the moment for Aus dollars. So you're definitely heading into that perspective. And then I really
Mhm.
want to continue combining, I guess, like the mental side of things and the physical side of things, because we're still at a stage where all body workers know, and I know that a lot of really skilled psychologists and a lot of people working in the mental health field understand this, that the brain and the body
Mhm.
are basically the same thing. You can't
Mm.
split the two together. But frequently in the medical model, when you go to hospital, or if people aren't too experienced, or if that's all they've been taught, those two things are treated as separate entities, and I don't think that really
Yeah.
works. Um, when a client walks into your treatment session, they're not just bringing their body in. You're not just treating a body. You're actually treating a person with a history and a body that is like a map to things that they can't even verbalize. The number of times I've started releasing people through like the neck, and they're like, "Oh, I remember this," and "Oh, by the way, like I came from war. Like my parents and I escaped from war, by the way, and this is exactly what it felt like when I was a kid because I felt like I was shouldering the responsibility."
Mm.
Um, and it's just cases like that. Like you can't dismiss what people bring in. That's actually the stuff that you want to be acknowledging and holding space for. And
Mhm.
through the FST and through the movements, that's also what we're wanting to help. But yeah, that's I guess where I see myself going, trying to combine the two a little bit more together, and hoping to continue working with other strength coaches and health professionals as well. Because normally we have like a referral system, so I'll get some strength coaches referring their clients to me. I've started taking on less coaching clients as well, so referring clients like that to them if they're needing strength training. I usually go, do you need a coach? Because you should go see them. Because after FSC, you need to do some strength training, and they're great.
That's
Yeah,
awesome. I'm glad you have that community and that referral source because I think it's important as us as FSD to outsource because
yeah,
like I think what Chris and Ann said, like you help get from where the client is to where they want to go. And if you can't finish that journey, then you have to pass it on to someone. And I believe that. That's so true.
yeah.
Um, for yourself, with the years of doing FST, how do you see fascia stretch therapy with the stretch to win evolving in the future?
I think it will always. I don't think it'll ever be as mainstream as anything else. Right now in Australia, we have a franchise called Stretch Lab. Um,
Oh
am I
yeah,
allowed
we
to
have
say
it.
that? I'm sure I'm. Yeah, okay, you guys have that as well. Okay, yeah.
Mhm.
And I know they're not fascia stretch therapy, but they use PNF, and I know they teach certain stretching techniques to the people who they train. But despite that, touch wood if I have wood, it hasn't really negatively impacted my business. If anything, I believe that there's space for both businesses to thrive, and it's just about people will come to FST for FST and what the therapist offers, and then those
Mhm.
other people who want different types of stretching or just want to feel good can go to the other places and other franchises, which I'm sure will still end up being a good experience. I just can't speak for it because I've never been to one. But I think it will always still continue. I think it will continue to get bigger, but bigger in a very subtle way. Um, so I think regardless of how popular it gets, I don't know if people will ever still, like, I don't think it'll ever become like massage, where you say, oh
Mhm.
yeah, fascia stretch therapy, and people go, oh yeah, I know what that is, if they haven't been to a session already.
Yeah.
Um, yeah, and I think that's kind of how it works for things that are a bit more real, because you can't just package it in a social media post and put it out. Try to package up what you do in a session. You envision your most successful client and or the first client who made the biggest impression on you as a therapist. Try to package that up in a Instagram reel and post it. You can't.
Mhm.
And that's why I don't think it will ever become like massage or like one of those franchise places, because there is something very individual about it in the way that therapists work with their client. But they're able to do this on such a big scale. Like you look at the number of people who are going to do these courses now compared to before. Yeah.
As far as like growing your business, whatnot, what marketing or strategies have you found most effective in like attracting new clients?
I put out a couple of Instagram reels here and there. I used to do a lot of like taster sessions when I went to comps. So I've done one at like a Muay Thai women's only sort of competition, sparring day. I've been to a few powerlifting comps to be able to offer my sessions as well. And then treated like 2 of my weightlifting clients at one of their big comps too. Unfortunately, I don't really find those to be hugely effective in terms of generating clients immediately. But
Okay.
when people have seen you and they repetitively see you, whether it's through social media or through referrals or just through seeing this person over and over again, people get a bit curious. And then they go, okay, well, I've had this thing that I've had for a long time. Should I go and visit? So I think it's good for things like that for planting the idea and exposure. Um, the other thing would be it's for a lot of it for me is like Google reviews and also just word of mouth. A lot of my clients come from referrals, or like just referrals from previous clients. And I think that's probably the best thing really because clients trust what other people say.
Yeah.
Yeah.
Do you actually go and ask them to give you a referral, or did you just do it on their own? Say, oh, this is awesome. Like.
No, so reviews I'll normally send out a link to people, but when it
Okay.
comes to like referrals, I've had clients just be like, well, I have a friend who's suffering from a chronic issue, I'm just going to send her to you, and then they book in normally like a couple of weeks later. So I don't really ask them. I don't think I've ever actually asked for someone to be like, oh yeah, can you tell people about me? I've
Uh-huh.
handed out business cards to colleagues, like being like, could you put this at the gym that you're working at? Flyers, things like that. Again, I don't really find them effective, but whatever level of exposure, especially as a small business owner, I think is good. You want to try and reach out as many feelers as you can. So yeah, that's a hard question. So when I first started practicing FST, I was still working for someone else. Great place, loved working there. And then I started getting people reaching out to me online for treatment sessions. And it was kind of, I had an idea like, oh, maybe it's time for me to branch out because I've been here for about 6 years now. I've learned a lot, but I feel like I could probably offer more if I could operate with my own rules and with my own time, things like that. So managed to kind of take the courage to take the leap into running my own thing, moved to another gym because I was offered a place there. And then it started off with I had a couple of clients from like the previous place who had reached out to me online, not the gym's clients, but my own clients. So they continued on with me while I was working at this new place. And then the team that I was working with in that new gym, they were very supportive of what I was doing. So they would usually refer their clients to me. They themselves came in and got some FSTs done as well so that they could see the value in it as well. And then they continued to do so. Once they understand what the treatment is, people are much more likely to talk about it because like, well, I know who this could benefit. I've got a client with, who's had back pain for about 3 years. And then, they come in and lie on your table. And then social media was probably a big one. So I just talked a lot more about it, started showing client results. Like the before and afters used to do really well on social media at the time. So that used to get a lot of people in. I think social media probably helped me reach a lot of people who otherwise wouldn't have known where I was. And I think that's the biggest thing for me. When you when you've done a course like this, which has been very financially, big financial investment, you have to also understand that that's not the end. You've got the skills and you've got the tools, but you also have to know how to market yourself and let people know where you are.
Yeah.
Unlike massage, people don't know what FST is, especially in Sydney. Most of my clients, if not all, haven't heard about FST until they've come and seen me. So with them, it's always like, well, if they don't know who I am and don't know where I am, then they can't find me in the first place. And that's one of the reasons why I was visiting comps and different sorts of events so that I could basically show myself and to let people know that I'm here. And I think that's how my business grew because I started trying to show up to different places so often. I was talking a lot more about it. I was showing what I do, but I also, when I started showing up a bit more authentically in terms of what my therapist values were and how I work as a person, I think that's when I also started attracting more clients who I want to work with, who, are willing to invest in the process. Look, some people come in, they just need one session and that's it. And then, they can come back for.
Yeah. Yeah. Um, yeah. Yeah. Definitely. Yeah. Cool. That's a lot of nuggets. Definitely. That's it. That's wow. Man. But my time, I definitely want to do a part two with you because, like, I believe, like, with the, with mental health, I wouldn't say, but I reached out to a mental health clinic here and offering my service, FSD, and I told them this could benefit your clients. I don't know, but she loved the idea, and I think that's something I want to kind of dive in. I want to do part two with you, definitely, so I could kind of discuss like how that mental health, the mental aspect with the body, like you're saying, how it's just so correlated, and how FSD can help people with this. I think that'll be awesome, interesting. Um, because this podcast, mostly it's for like people who are wanting to learn FSD, who, or to become a practitioner or wanting to learn what FSD is. And I want to really highlight like how different areas of our health that FSD can incorporate, which is whether it's fitness, the mental health aspect, I mean, even the emotional. I mean, there's so much different benefits with FSD that you can, people can benefit from. So, um, to close off, I'd love for you to share with the audience because I want to promote, encourage listeners to follow you, and of course, learn more about what you're doing. So if you don't mind, share how people can follow you on website, your social media handle, email, or best way to contact you, book a session. So go ahead. Cool. And for those of you who are want to learn how to become a practitioner like Erica and myself, you can go to stretch2one.com. Don't forget to mention Ian Ray that I sent you there. So you can either find a practitioner near you or you can become a practitioner yourself. So you can add this to your tool set, to your practice. Kirsten and Frederick have done such an amazing job just with the research and with this modality of teaching. I think it's such a beautiful thing. So please go and visit. Don't forget to subscribe and follow the Stretch to Go podcast. We release new episodes every Friday at 7 a.m. Eastern Standard Time. Erica, it's been a pleasure just learning more about what you're doing there in Australia. Thank you so much for hopping on. Appreciate it. Yeah.